So just recall that post-operatively, there's typically 3 rules. There's only 3. They're not fun, but they're only 3. They're all really wrapped up and they're related to each other. Clearly and obviously, elevate your leg. Makes sense. We just want your incisions to heal quietly. When you come back for that first post-op visit, we love your incisions to be happy and quiet and healing, not angry and red and swollen beyond what they should be. Rule number 2, inactivity. It's hard because we're people, we all like to do stuff, but just recognize that again, coming back for the first post-op visit with incisions that are quiet and healing and less swollen, less swelling, less pain. So clearly inactivity is related to elevating your leg. And finally, arguably most important, do not bear weight on your leg, even if it doesn't hurt. Recognizing that likely what we've done to you requires an early period of healing, whether it's bones, tendons, ligaments, or even just the skin. It's going to heal better if you basically have been elevating, don't bear any weight on it, and be inactive. Okay, so let's talk about managing medicines and pain post-op. There are 2 honorable goals. Goal number 1, we don't want you to have more pain than you need to have post-operatively. Honorable goal number 2, we don't want you to use more opioid than you need to do either. So there's actually a number of things that we do to achieve this. For example, elevating your leg. It sounds so simple. It's low tech. Maybe you might even want to poo-poo it like it's not important. It's really very important. Doesn't it make sense? The less soft tissue swelling, the less pressure, the less pain. So I want you to think about elevation as like a form of a pain medicine. So think about that carefully. Number 2, the block that you had. Keeping you numb from your knee down on the surgical side only for an extra 1, 2, or maybe 3 days post-operatively, doesn't it just make sense that when that block wears off, that it will be less uncomfortable than the old days when people were in pain as they're rolling into the recovery because they already feel their leg. So let's move into meds post-op, but not yet opioids. There are typically 3 medications that we use that we want you to take for the first 3 days post-operatively. These medicines, which I'm going to tell you about in a second, they're the nice guys. They get along well, they play nice in the sandbox, whatever metaphor works well for you. They're easy. I want you to think of them as on autopilot. They each work by different mechanisms, so you can take them the first night of the surgery, even with the same glass of water, and then follow their directions, which will say it on their bottle, for the next 3 days until they're gone. Think of it as a bridge. These medicines are Tylenol, and Tylenol is not a miracle drug, but it is a low-level pain reliever. Why not have it on board? Number 2, ibuprofen, good old-fashioned Advil or Motrin. It's not a miracle drug either, but it does reduce pain from its inflammatory component as an anti-inflammatory, so why not? And the third medicine is a medicine that's used for lots of different things, but in surgery, this medicine, which is called gabapentin, its other more common name is Neurontin, sounds like nerve, right? So Neurontin is a medicine that tends to reduce the hypersensitivity or the nervy component of pain. So take these 3 medicines the evening of your surgery, take them with the same glass of water, follow their directions individually until they're gone. Let's just call them a bridge.